foods that are good for your heart by improving your cholesterol. Hello everyone, if you are looking for exclusive deals, blogs, educational content every week delivered to your email, subscribe to our newsletter at SugarMDs.com right now. Some meals have been shown to protect your heart, right? Either by their effect on cholesterol or triglycerides or other mechanisms. Well, the manner you prepare these natural foods has significant impact on your health. Now, of course, we prefer boiling, steaming, and grilling, right? These are preferable. But while cholesterol is essential for the body function, as you know, too much cholesterol can actually lead to health problems. Now, by the way, for those who think cholesterol is good for you, I'm asking you, if cholesterol was so good for your body repair and function and all that, how come babies have the lowest cholesterol, right? Well, don't they need the highest cholesterol amount in their blood to grow, right? They need the most. Plus, they eat all the cholesterol and they are not on a diet. Well, because our body starts making more and more unwanted cholesterol as we get older. You can call this programmed death if you want to, but that's what it is. Yes, a little cholesterol is needed in your body, but too high cholesterol levels can cause plaque formation or buildup in your arteries, and that leads to heart disease. That has been proven 1,000 times. Now, let's talk about foods that actually help keep the cholesterol at bay. Now, vegetables and fruits is very important, right? Consumption of fruits and vegetables have been shown to reduce the risk of cardiovascular disease. Now, they are low in saturated fat, and most of them actually don't even have one. And they're high in fiber, they're low in calories. And most of the time, if you don't overconsume them, they will help you lose weight. Now, phytochemicals or natural plant substances like vitamins and minerals and antioxidants in them as well are very beneficial for your health. Also, remember, walnuts, almonds, cashews. These are examples of nuts that can help your cholesterol. Again, according to many studies, eating nuts, especially those certain nuts we talked about on a regular basis, can cut your cholesterol levels and reduce your total cardiovascular risk. Now, that is largely due to the fact that nuts, in addition to being high in unsaturated fats, they contain plant sterols and stenols, and they're high in fiber as well. I would choose unsalted nuts if you have blood pressure problems. Now, fiber that is soluble also, for example, peas, beans, lentils, broccoli, apples, berries, prunes, etc. They're just a few examples of those good vegetables as well. Now, soluble fiber is also abundant in whole grains. Having said that, they help cholesterol levels. However, if you have diabetes, you will need to be careful about not to overconsume because high blood sugar can happen from overconsumption of whole grains. Now, barley and oats, for example, they are high in something called beta-glucan, which is a type of soluble fiber that forms a gel in the body that actually binds the cholesterol and prevents it from being absorbed into the bloodstream. Another thing you should be consuming more is fatty fish. They are a good source of omega-3 fatty acids. They can help lower your cholesterol levels for sure. And there are studies behind it as well, especially eating fatty fish on a regular basis, at least 3 times a week, for example, can reduce the bad cholesterol by up to 10%. Now, in addition to that, fatty fish is actually a healthy source of protein and other nutrients, as you know. Try to go with the wild-caught ones if you can. Now, fatty fish, definitely, if you're not into fish, I would suggest try slowly getting into it because that is very beneficial. Now, diabetic patients are also advised to have omega-3 fatty acids, which, again, fatty fish has lots of those as well, because omega-3 fats, as you know, they're also proven to prevent and treat cardiovascular disease. Again, remember we talked about walnuts, chia seeds, flax seeds oil are also good vegetarian sources for omega-3 fats if you cannot eat fish at all. Now, there are also a group of foods we call functional foods, okay? Now, diets or food ingredients that have components that provide specific health advantage beyond the fundamental nutritional content, beyond like the conventional foods, their value and so forth. If there's an extra benefit to these foods, we call them functional foods. Now, many items promise to provide health benefits, and some of them have been really scientifically confirmed to be effective. One of them is probiotics, for example. What they do is they aid in the growth of the beneficial gut flora, and plant sterols and stenols, for example, they are again higher in concentration of products or plant sterols that reduce cholesterol. They are called phytosterols overall. Again, look for plant sterols or stenols in these naturally occurring compounds. Those things can be found in small amounts in fruits and vegetables and nuts and seeds. But some studies actually shows that up to 2.4 grams of plant sterols every day for 2 to 3 weeks can actually lower your cholesterol levels quite a bit. Now, of course, they must be consumed on a regular basis at meal times in order for it to be effective, because as you know, plant sterols actually bind the cholesterol that is in your food. Now, clinical experiments have also demonstrated that there are meals that are fortified with sterols and stenols can also be beneficial in lowering cholesterol levels. Foods that have nutrients added to boost their nutritional content, for example, and avoid deficiencies, such as fortified foods, are considered functional foods as well. Now, sterols and stenols can also be taken with statins if you're on them, or even fibrates like fenofibrate, without causing any negative side effects as well. If your medicine is working the same way, if you're on ezetimibe, for example, these functional foods may not be very helpful because ezetimibe does the same thing, that basically blocks the cholesterol absorption through your diet. Again, there's not much you can do about the liver making too much cholesterol that is age and genetic related. So if you're doing everything and you are not successful, you will either have to use a medication or some herbal medication or a natural medication or a regular medication, whatever you prefer, to help your cholesterol. Soon enough, we are going to have a cholesterol support on our shelf as well, online shelf, not in a store, right? But basically, probably we are still in the testing phase. I would say in August or September frame, we should have some very powerful cholesterol lowering medication or a herbal medication in that regard. So stay tuned. But like I said, diet is something that is definitely on your side. The more you do on your diet, the less you have to do with the medications and herbs. So thank you very much for watching, and I'll see you in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.